Our multidisciplinary coordinators are what they're called, but they're truly navigation for the entire process of the breast cancer care that they get in the Brown Surgical Associates and the Brown Health Cancer Institute.
They are very much an extension of us. They really help guide the patients from the day of diagnosis beyond surgery in terms of getting their follow-up care. They are always available either by phone or by email. They help the patients with their paperwork, making sure that they know what is the next step, where they need to go. They're a very important part of our team in making sure that people get their care in a very timely manner.
Navigators are so important to really understanding the patient's well-being, but more than that, she's that touchstone to the MDC clinic from which everything else stems.
The coordinators are trained in navigation. They recently completed a master certification in navigation, and so they have all the skill sets and the knowledge about breast cancer that is far beyond most medical students and some residents. From that standpoint, the patients understand that they're getting information from a person that is knowledgeable about the system, but also knowledgeable about their care and is compassionate and has seen this process so many times that she understands what they're going through.
Jen is truly my right-hand person, and I couldn't do what I do without her. She not only is the point person for my practice, she makes everything happen. She's the first person that these patients talk to, the person who coordinates their visits, not only with myself, but with all the other providers. She's the person who makes sure everything that needs to happen for these patients happens.
It's just an amazing component of what we do for practice, and we hopefully don't take it for granted because this is my right-hand person. The amount of dedication that these coordinators have for this practice of breast cancer care for our patients is invaluable. The entire team is really good at understanding that anxiety that the phrase breast cancer brings about in a patient.
When I'm checking out a patient, I'm like, go down the hall and say hi to Jen and make your appointment for the next time. And they're all really excited to see her because that's where it all started. And she was a warm, kind of welcoming and reassuring presence to them from the beginning.
So when I think about Diana as our navigator, I really feel like she's the heart of the practice. She is always extending herself towards the best aspects of patient care, and she does it with heart. So I'm very, very fortunate to have Diana in my corner. What I would like to say to Diana is, I see what you do for each and every patient, how comforted they are by having you part of the team. You're not replaceable, and I'm so grateful that I get to work with you.
Keep up the good work because they do add a lot of value to what we do.
To Serena, I would never want to do this without you because you're invaluable to my practice and taking care of our patients because they're always our patients. Besides, who would I call on Sunday night at 10 o'clock to ask a question and you'd be right on the phone on your computer too. You are the heart and soul of my practice along with me and the rest of our team. We are a team forever. Thank you.